lost 3.
Eileen just got it.
Okay.
For 3 minutes.
All right. Good afternoon. This is the Elbert County Board of County Commissioners meeting as the Elbert County Board of Health. Today will be primarily an informational update. We've received some questions via email prior to the meeting that we'll endeavor to answer as we go through this. Would ask those of us at the table and Dwayne just to make sure you're speaking directly into the mic. We've had some folks contact us and say the audio wasn't great in the room if people were leaned back. So with that, it's time's now 12:09. Amanda, could you call the roll, please?
Commissioner Richardson?
Here.
Commissioner Dare?
Here.
Commissioner Pettit?
Here. Okay, thank you. Dwayne, I guess we'll turn this over to you.
Do we need
no-
to make a motion to open the meeting?
Oh, I suppose we do. Yeah. Yeah.
I'll make a motion, we open the Elbert County Board of Health meeting on 4/15 of 2020.
Second.
Give motion and a second to open the Board of Health meeting. All in favor, please say aye.
Aye.
Aye. Okay, we'll start with the pledge. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you, Dwayne. We were following on another meeting and just kind of spaced that. So, yeah, if you could, I know you had some updates for us and some questions that had come in, and then we'll move forward. So, thanks.
Thank you, Mr. Chairman. Good afternoon, everyone. I'm Wayne Smith. Good afternoon, commissioners, staff, and citizens listening in electronically. What I want to do is give a brief update on, a situation update on the status of the coronavirus COVID-19 in Colorado and where I can provide information and update on Elbert County, how it's affecting Elbert County. As of today, we have 17 confirmed cases in Elbert County, including one. Okay, let's restart that. I apologize for that, not realizing the mic was on. Good afternoon, everyone. I'm going to provide an update on the status of the coronavirus COVID-19 situation in Colorado and, where applicable, how it is affecting Elbert County. As of this morning, we have 17 confirmed cases of Elbert County residents, including one fatality resulting from an infection, a virus infection. At least one of those cases is isolating outside the county. In other situations, the cases have previously been on isolation. The virus has run its course, and they are no longer capable of communicating the disease. CDPHE, the Colorado Department of Public Health and Environment, estimates that the actual number of cases may be anywhere from 4 to 10 times more than that, more than our 17 confirmed cases. That is, I should emphasize, a conservative estimate. Other models around the country estimate numbers much higher than the 4 to 10 times. We are aware of many additional cases that have not been confirmed via testing. And as a reminder, testing supplies are limited, testing kits are limited, personal protective equipment for the medical personnel conducting the tests, that is limited. Testing is currently reserved, or prioritized, I should say, for the healthcare workers, for public safety, first responders, EMS, fire services, law enforcement. The reason for that is we need to preserve, as a state, as a nation, the healthcare safety net and the public safety net. Many of those professions, those individuals, we don't have backup for. So it is critical that they remain safe and healthy so that they can continue performing under, unfortunately, the extreme conditions that they are working under. And I'd like to recognize all of them that are doing that great work day in and day out to protect our citizens. The cases in Elbert County have concentrated in 2 zip codes, 80107, which is Greater Elizabeth, including the town of Elizabeth, and 80138, which is actually labeled a Parker address, but does include geography in the northwest part of Elbert County. It is unknown how many Elbert County residents have been tested. I suspect that there are very few folks that have been tested. In the county, we have had Okay. Apologies again. It is unknown how many Elbert County residents have been tested. I believe there are probably far too few. We are continuing to work with the State Health Department to identify potential options to bring testing to Elbert County citizens. Of the Coloradans that have been tested thus far, and that number totals approximately 40,000, 1 out of every 5 Coloradans tested has come back positive for the virus. When looking at who is susceptible to acquiring the virus through community transmission or other means, the state has developed and adopted a susceptible, infected, and recovered model, or SIR as an acronym, SIR. The model is predicated on the belief that everyone, all citizens, start out in one of these 3 boxes. They're either susceptible, they're either already infected, or they have been infected and are recovered and presumably are immune from acquiring the virus again. What determines whether a person moves from the susceptible group to an infected group includes a contact rate, and that's the rate at which susceptible individuals contact infected individuals. This can be mitigated by the stay-at-home, adherence to the stay-at-home orders, adherence to the social distancing when it is necessary to go out, by other layers of protection, regularly washing hands, using face coverings when it is necessary to go out, and so on, that I believe everybody is familiar with by now. The probability that someone will transmit the virus to another person relies on the amount of given contact and the closeness of the contact between an infected individual and a susceptible person. More frequent contact and communication obviously raises the risk of a susceptible person becoming infected. We want to make sure that the most vulnerable populations, the elderly, the immunocompromised, those that have been recovering from medical procedures or other healthcare conditions, that those are, the social distancing and the stay-at-home are especially important for those folks. This next slide, I just want to touch on briefly. It is known that for every infected person, that person is potentially infecting between 3 and 4 additional people. And of those 3 or 4 additional people, each of them is infecting 3 or 4 more people, and so on and so on. And it's easy to see how this virus can quickly get out of hand in terms of community transmission. If you've been following Governor Polis's updates periodically, he has previously talked about a basic reproductive number, which is termed the R0. That's the number of secondary infections produced by an infected individual in a population where everyone is susceptible in the absence of any protection, any vaccines, or things like that. And again, it's worth noting we currently, there are no vaccines available for the COVID-19 virus. Whether that number of people, subsequent people infected, is closer to 3 or whether it's closer to 4 dramatically influences the number of Coloradans that will potentially be hospitalized and potentially die from the virus. So again, the reproductive number depends on the contact rate and the probability of transmission, and also the duration of infectiousness. Some people are contagious for a longer period of time than others. Some have the virus run its course in a day or 2 less. Typically, it is at least a week. It can be as many as 10 days for the virus to run its course. This slide assumes that almost 100% of the population is susceptible, and the reason for that assumption is simply because this is a new virus. It has never been seen before in humans, so we have zero immunity to this virus. State public health leaders have also developed a Colorado model to look at a schematic by which folks become susceptible, or folks become exposed, to the virus and their ultimate disposition. So assuming everyone's susceptible and depending on social distancing and stay at home and other personal health practices, whether they become exposed to the virus. Some people will have symptoms of the virus, some significant symptoms, some very mild symptoms. Some people will not have any symptoms and be asymptomatic, and the virus will simply run its course and they will recover. Folks that have symptoms, depending on the robustness of their immune system, the virus can run its course with just treating the symptoms at home and self-isolating, or in more serious cases, they may need hospitalization. They may need hospitalization in an intensive care unit where they could potentially need a ventilator to assist with their breathing, or they may not. They may be in a different, less acute unit in a hospital. And hopefully the majority of those are going to recover, but sadly we know that some of them are not. This model really speaks to the need for everyone in the community, whether your job or life situation keeps you in the community, or whether you're an essential worker and you have to go outside the Elbert County community to work or to access basic needs. It really speaks to the need to reduce the contact rate, which is the social distancing, and also to isolate cases that are symptomatic, even those that have not been tested. I believe I said in our last meeting, due to the dearth of testing, if you are experiencing symptoms of the virus, consistent with what your healthcare provider is telling you or other reliable sources, assume you have the virus and isolate accordingly. That means in an ideal situation, you are not coming into contact with other family members in your home. We understand that's not always going to be possible, but if it is possible, ideally that infected person has their own access to their own bathroom, their own meals, and things like that. So it does require a significant amount of coordination, both to get the infected person their daily needs and have their daily needs met, but also to keep the rest of the family from becoming infected. So one of the common questions we hear, it's really the $64,000 question, is when is this thing going to be over? And the most direct and honest answer is we still don't know. We are still learning day by day about this virus and the far-reaching implications it has had on our lives, on the economy, on our health, both individually and collectively as a community and a state. So public health leaders have looked at a couple different phases of the social distancing. And phase 1 of social distancing was really implemented on March 17th, and that coincided with the announcement that all the ski resorts and other recreation facilities were going to be closed, and the shutting down of restaurants and gyms and other locations where people frequently access resources or meet or bars and things like that. We saw or have been seeing the expected impact of phase 1 on those cases between March 30th and the first week of April. Phase 2 of social distancing really began in earnest on March 26th, and that is the date when Governor Polis issued the stay-at-home orders, the social distancing measures. Given the lag time between that date and the effects of people adhering to that, we are currently seeing the impact of phase 2 being reported this week, the next week, and perhaps the following week. So I'm talking about today is the 15th. Officials estimate that the initial effects of phase 2 were being reported beginning on April 8th, I believe. As to when we may be able to resume some semblance of normalcy, that remains to be seen. We are continuing to monitor all reliable and available indicators, including hospitalizations and many other indicators such as traffic and cell phone migration as people are staying at home. Again, it is my belief that we need to prepare for this for the long haul. And by that, I'll define that as at least until early June. Once the restrictions begin to see some easing, it won't be, the analogy I've made in previous conversations is turning on a water spigot. It will be turned on with a trickle. It will not be turned on with the faucet completely open. I know the governor's office and other public health leaders are working on defining exactly what that will look like. It is safe to assume that, for example, with restaurants, I don't believe will go from being closed to being completely open. They will most likely have part of their dining room partially open. Maybe a third of the dining room open while still adhering to social distancing provisions. The same with other public gatherings. You're probably aware of many community events that have been canceled to date, including the Elizabeth Stampede Rodeo. It is safe to assume that other community events on the calendar, again, depending on what public health leaders advise, the gatherings will most likely be limited, and social restrictions will be eased over the course of the summer and may even extend into the fall. I want to make sure that the businesses that have been impacted by these restrictions and executive orders are availing themselves of all the Small Business Administration loans and other resources that are being put forth at the state and federal level. We understand that there has been bottlenecks and challenges with capacity and processing applications, and just encourage everyone to stay the course and keep pursuing those options, and hopefully we'll be providing or be provided with additional bandwidth from the federal government to address some of those business concerns for local economies. The current situation in Elbert County, again, the social distancing measures implemented in March appear to be slowing the growth of COVID-19 in Colorado. The trajectory of the outbreak and the number of deaths and hospitalizations depends in large part on how well we continue to reduce contact now and in the coming weeks, and I probably would say in the coming months. High adherence to social distancing have the potential to bend the curve, or I'm sure folks have heard the term flatten the curve, leading to an earlier peak and a lower peak. But disease control measures will be needed to prevent additional peaks. One of the things we are all cognizant of is the potential for the number of cases to flatten, only to resume because later on in the calendar, because we didn't continue the practices that we have been working on the last several weeks. Questions we're trying to solve moving forward include: how long will people comply with the social distancing order? We understand that citizens are tired, they're frustrated, they have cabin fever, they're being asked to do things that they've never had to do before in their life, including serve as their children's teacher and help them, which in and of itself is a very daunting challenge. We're concerned about that might have for a subsequent rise in the number of are, especially in terms of how the virus is affecting people of color. We know that more so than white counterparts, people of color have or are working in hourly wage positions and in roles that don't allow them for sick leave or paid time off. And they are more predominantly working in service industry jobs that have more frequent and closer communication or contact with individuals that may be infected. So we're trying to solve all those questions from a statewide perspective. We still don't have a good handle on how many people have been infected, how many people whose infection has run its course and are now immune. We still have dramatic challenges with bottlenecks in acquiring testing resources. If you listen to any daily news media, you've probably heard about the challenges and states competing with one another, hospitals competing with one another, everything from personal protective equipment to ventilators and many of the other necessary resources. I anticipate we'll continue to see those challenges for, again, the next several weeks. And then one of the hardest questions we're trying to find an answer for is how do we balance the need to control the disease with the economic priorities of Elbert County and of our communities and the state. And honestly, that's a near impossible question. It's kind of a chicken and the egg question. We will be relying on state models and economic experts, as well as public health experts, to guide us through that conversation for each community. If citizens have questions, please feel free to reach out to me with questions, concerns. Verbalize my cell phone number. I am working remotely from home. I can be reached via cell at 720-692-4067 and via email at dwayne.smith@albertcounty-co.gov. And I will take any questions that anyone has now. Oh, sorry, one last thing. I do want to acknowledge the great work of the Elbert County COVID-19 leadership team, our county manager, Sam Albrecht, Deputy Manager Eileen Krauth, Commissioner Richardson, our county lawyer, Bart Greer, and our Office of Emergency Management Director, Chris Jabakowski. And Chris has been, Alex Jabakowski. Sorry, Alex. I was looking at Chris and thinking, Chris.
I've got hair.
Alex has been making his rounds across the county delivering PPEs to first responders, and he's just been doing great work, yeoman's work, in making sure that the first responders and everybody else has the resources they need. So thank you to everyone involved in those daily updates and conversations.
Thank you, Dwayne. Guess a couple of the, I know folks at home are frustrated. We are here, when we talk about just what we know and the information we have to make decisions, it's sparse at best. As you mentioned, we don't know how many people in the county have been tested. We know when somebody in the county who's been tested tests positive, but not how many have been tested. We know we got reports of how many people are hospitalized at the state. We don't know how many people may have been hospitalized from our own county. We know we have a death because a coroner responded. I'm not sure if we know of any deaths of a resident that may have been hospitalized outside the county. So only if the coroner responds here do we really have a definite knowledge of a death. So in terms of what to do or how do we use that information if the time comes and the state does start relaxing, and it could be a couple of weeks, it could be a couple of months. I personally hope it's more of the sooner, but if the onus is then put on the counties to make decisions, the information we have to make decisions on is pretty light in terms of the health conditions of our residents. I know you had talked a few days ago in one of our meetings that there's potentially a self-reporting tool that was going to be coming online that would allow residents that perhaps were under a doctor's care, that again, we don't know who's in contact with the doctor and been told to self-quarantine, people that have had symptoms and self-quarantined without seeking medical advice. We just don't know that. Is there any movement on that tool becoming available?
Yeah, all good questions. And to the commissioner's point, we were really trying to identify opportunities to address the situation from the start with virtually no data, virtually no guidance. It's important to remember that when we talk about the number of cases, that really represents the tip of the iceberg, and we shouldn't be inferring a whole lot from the number of cases. one of the most valuable metrics that state and local leaders will be using to determine when the time is right to ease these restrictions include the number of hospitalizations, the duration of an infected individual's hospitalization. It may be anywhere from a week to 3 weeks. We are aware of individuals that have been hospitalized for upwards of 30 days and on ventilators for nearly 3 weeks. From a hospital data perspective, hospitals can measure the number of ventilator days that someone or a collective population is on a ventilator. The number of ventilators being used or deployed in certain communities is going to be another indicator. So to try to get a better handle on getting more actionable data, the State Office of Information Technology has been working with Google engineers and I believe the Colorado School of Public Health to develop a self-reporting platform, a web-based platform whereby folks with symptoms of the virus that have not been hospitalized and may be self-isolating or quarantined can report their symptoms, for example, their duration of the symptoms, their date of onset for the symptoms, what their symptoms are from the laundry list of symptoms that accompany an infection. And that can be stratified by geography, by gender, race, ethnicity, if folks care to report that. It will have a text messaging capability to communicate back and forth between the infected individual and I believe either a provider or an epidemiologist that is monitoring their condition so that they will have more definitive guidance on when they are no longer infectious and they can basically get out of isolation in their own home or wherever they may be isolating. The state, we hope the state is going to push out a press release announcing that platform either this afternoon or hopefully no later than this morning if they don't push it out this afternoon. So I know they've been working long hours to get that up and running. It will be very user-friendly. It shouldn't take more than, certainly no more than 10 minutes, I believe, to enter the information. And we encourage folks that have symptoms or otherwise believe they have symptoms to utilize that platform. We will be pushing out messaging via press release at a local level to community leaders so that they can then disseminate that availability of the resource to the community.
Yeah, I just anticipate there'll be concerns over privacy, and I have them too.
It is
but-
totally
and it's
opt-in.
Right,
Totally
no, and I
opt-in.
get that, and it's just like I said, it seems like where we're at this point is we don't know what we don't know. Decisions have been made very much erring on the side of extreme caution.
Agreed.
We've asked people, and I guess the governor's directed people to give up individual liberties because there's no good definitive geographical based, I mean, as we start opening up, I think this just becomes very important, and I would ask, citizens to truly consider opting in, because the better information we have about ourselves, the better decisions that can be made, and not, as I said, I think it is frustrating. There's nothing else that comes out of this. It's just very frustrating that citizens are being directed to do things for their own good and very likely for everybody's benefit, but without really good data to rely on. I guess that I'll leave it there.
That's the frustrating part of dealing with this new virus.
Okay. Sam, did you have something?
Commissioners, I'll also mention that we have started loading and hosting some information on the Elbert County website. It's off the public health page for COVID-19 resources for the community, for individuals, businesses, and so we're going to continue as information comes out and links and recovery efforts. We'll be putting information up there, as well as updating our social media, our Facebook page, and Twitter and our other social media feeds.
Thank you. Do you have any questions? or-
Yeah, I just want to, and I know there's no good answer to this, but, you know, when I talk to fellow citizens of Elbert County, there is a general feeling that, boy, I'm glad that we're working on the disease part of it. But the conversation rapidly changes. And that goes, well, with the economy going down the tubes, cabin fever setting in, what about the associated stuff? Depression, suicide, family violence. And when do you expect, and when should we be concerned about a public people revolt?
Good questions. So I'll start with the latter part of some of the things you touched on. We know that when people are isolated, incidents of domestic violence and child abuse will go up. And it's my understanding that in Elbert County, they have. I do want to single out the town of Elizabeth as having done some just great compliance as per comment from Chief Hasler with the Elizabeth PD. He noted in a call the other day that they have not seen hardly any incidents of domestic violence and child abuse, and really attributed that to the community adhering to the social distancing and the stay-at-home orders, and just generally keeping the peace. So I want to acknowledge the town of Elizabeth for that great work. As far as the mental health side of things goes, again, we know that people are under tremendous amounts of stress on top of the levels of stress they had prior to this virus manifesting in the community and in the state. So we want to make sure that people are availing themselves of all the mental health, behavioral health resource options that the state has to offer, and we can make sure we get those on the county website, whether they are helplines or provider call lines or other mental health professionals that are offering, and organizations that are offering resources for families and individuals. Regarding kind of when people have had enough and they can't take it anymore, all I can ask folks to do is stay the course and do the best that you can. Practice self-healing on a daily basis, however that looks like for individuals, whether that's spiritually or yoga or taking a walk, anything you can do on a daily basis, and that's regardless of whether there's an epidemic going on. There's an increasing awareness of the role that mental health plays in everyone's lives, and the state, by and large, has been doing a great job over the last probably 8-9 years of destigmatizing folks with mental health issues, which is to say all of us. We all have mental health issues. We're just human, and some of them manifest themselves in ways that make it more difficult for folks to live their daily lives than others, and others do a better job of managing that. But it's important to note that we all have challenges when it comes to our daily health and especially our mental health. Did that help? Did that answer your questions? I feel like I've missed something there.
It'll be fine.
Absent a date?
Yeah, but, you know, the people unemployed and those kind of things, we've got to be understanding that there is huge pressure on individuals.
Absolutely.
And I understand about government money and all this kind of stuff, but that doesn't satisfy a person's self-worth.
Agreed. I wish I had an answer for that.
Yeah, I know we had at least a couple of questions that came in that honestly, I think they've been addressed during this. There was, I think, some specifics about some employer requirements that we really can't answer. I would encourage anybody that feels like their business is putting them in danger because of a process or that, you know, I think contacting public health just to start that conversation is the right way to go. I know Dwayne has talked to several business owners since this began on that have been designated essential, or at least there was silence in the order to help them work through methods and practices that would reduce risk to employees or customers coming in. And I truly appreciate that, because anything we can do to keep businesses that can be open safely will help us in the long run. So, for that, I do appreciate it.
Yeah, I would just add, once the restrictions do ease, I would just encourage everyone to shop locally, patronize our local businesses, keep the money in the county, and help your friends and neighbors get back on their feet with the businesses that they are proprietors of.
Okay. Yeah, and I would add for county services, just about everything the county does provide is still available through alternate means. If there's something very specific that's not being addressed, I'd ask you to either contact the commissioners or the elected official over that area. We'll continue to work to you know, add or make those services better. If when the time comes to start opening up, we'll likely kind of go in the reverse that we shut down. If there's specific face-to-face things that have to happen by appointment, limiting the number of people in buildings once they do open back up, and scaling in that way slowly backwards from the way we went in. There's quite a bit we can and have learned as a county and how we can provide services more directly to folks without them having to come to Kiowa, which in the long run I think will be a benefit to all and something we can continue to keep in place. But if there aren't any other comments or questions, I think we're about ready to close. But I would add to the list of people that were thanked today is Dwayne and his staff. They have been, you know, it's a public health department of 3 that up until a few months ago was focused almost primarily on septic inspections and tracking summer rabies cases, quite honestly, and then, you know, periodic health assessments and keeping information available to folks. But it was, I guess, marathon versus a sprint type, and you've been sprinting now since you arrived, and I appreciate that. So,
Thank you.
yeah. So with that, I'd take a motion to adjourn.
I'll second.
Okay, we have a motion and a second to close the Board of Health meeting. All in favor, please say aye.
Aye.
Okay, and I guess motion to adjourn. Yeah,